Okay, so hello everyone, my name is Hala Halwani and I'll be talking about joints of the ankle, foot, and arches of the foot. So first I'll introduce by talking about the bones that form the ankle joint. We have the tibia medially and we have the fibula laterally. We have the talus right here and the calcaneus. Now the ankle joint could be visualized using the tenon and mortise joint. This is the mortise and it forms usually a socket where the tenon goes in. Same thing here, mortise could be visualized as the tibia and the fibula, which form a socket where the talus goes in. First joint is the talocrural joint, which is the true ankle joint. It forms between the tibia, the fibula, and the talus, right here. This is a hinge synovial joint, and usually it helps in the movement of dorsiflexion and plantar flexion. So this is the foot right here. Dorsiflexion would be up, and plantar flexion would be down. Next joint is the subtalar joint or the talocalcaneal joint. This is between the talus right here and the calcaneus, and it's also a plain synovial joint. Usually helps in the inversion and eversion of the foot. So again, this is the foot, this is lateral, and this is medial. Eversion would be outside laterally, medially would be inversion. Next is inferior tibiofibular joint. Right here, the joint is used for stability of the ankle joint. This is the fibula and this is the tibia. And the joint forms right here using some fibrous tissue. Next is talonavicular joint, which is between the head of the talus and the navicular bone. So right here, and it's also part of the transverse tarsal joint, which I'm going to talk about later. And we have movements involved in complex inversion, eversion, and also dorsiflexion and plantar flexion. Last is calcaneocuboidal joint, which is between the calcaneus and the cuboid bone, and it's also part of the transverse tarsal joint. Okay, so here are the common joints of the foot. So here, as I said, we have the transverse tarsal joint, which is right here, and it's between the tarsal bones. And then we have the tarsometatarsal joint, which is right here between the tarsal bones and the metatarsal bones. We have the metatarsal phalangeal joint between the metatarsal bones and the phalanges. We also have interphalangeal joints. We have proximal and distal. So these are the proximal interphalangeal joints and these are the distal. Okay, now the ankle joint cannot work properly without the ligaments. So I'm going to touch briefly on the ligaments. We have the lateral collateral ligament and the medial collateral ligament. Lateral collateral ligament is usually formed from the posterior talofibular ligament between the fibula and the talus posteriorly, and then we have another one between the fibula and the talus anteriorly, and we also have the calcaneofibular ligament between the fibula and the calcaneus right here. Next is the medial collateral ligament, also known as a deltoid ligament because it's like a fan-like structure. So we have the posterior tibiotalar part between the tibia and the talus, and we have the anterior tibiotalar part between the tibia and the talus right here anteriorly. We also have tibiocalcaneal between the tibia and the calcaneus, and tibionavicular between the tibia and the navicular. Now we have the arches of the foot. We have the medial longitudinal arch and the lateral longitudinal arch. We also have the transverse arch right here. As you can see here, we also have the medial and the lateral. Now, what are the benefits of these arches? First is shock absorption. They act like springs and they absorb the impact forces generated during walking, running, and jumping. Next is weight distribution, and this happens when the arches distribute the body weight across the foot and up to the lower limb, and they help to maintain balance and stability during standing or even movement. Now, spring and propulsion. This happens during the usual gait cycle, where the arches temporarily store mechanical energy when the foot strikes the ground, and then this energy is usually released as the foot pushes off. So this aids in efficient forward propulsion and reducing muscular effort and conserving energy. Next is adaptation to surfaces. So the flexible structure of the arches usually allows the foot to adapt to uneven surfaces and enhancing its stability. And also protection of soft tissues because the raised arches usually protect blood vessels, nerves, and even muscles on the plantar surface of the foot from any compressions. Thank you so much.